Have you always been thinking about having aesthetic surgery to enhance your breasts, but we're not sure what operation is the best option for you? I have the answer to that question in this video, so stay tuned. There are two important questions you have to answer. Number one, are you happy with the size of your breast? And number two, are you happy with the shape of your breast? The combination of these two answers dictates what is the best surgical option for you. So the first scenario is if you are happy with the shape of your breast and if you're happy with the size of your breast, this is very clear. You don't need any help from any plastic surgeon. You look perfect. Second scenario is when you're happy with the shape of your breast but not happy with the size. Now, it can be either of two situations. Either the size is too big or too small. Most of the times when somebody has a very large breast, it's a little bit droopy as well. So for these patients, a breast reduction would be the operation that suits them the best. The other groups are the patients who are happy with the shape of the breast, but the size is too small. So you need to do a breast augmentation where we use breast implant to increase the volume of the breast. There is another option which is not as common as breast augmentation, and that's fat transfer to the breast. The third scenario is when the patients are happy with the volume but they're unhappy with the shape. So this can be a situation when patient has enough breast tissue but they are sitting a bit low on the chest, or they had a few children and the breast became a slightly droopy, but they still have enough breast tissue to make a good pair of breasts out of them. One easy way to test that is if you put a pair of support bras or push-up bras and then wear a tight t-shirt and look yourself in the mirror. If you're happy with the volume you see or the contour of your body, that means you probably have enough breast tissue to have a good shaped breast out of them. So these patients are mainly getting the problem with droopiness when they're naked with no bra on. For these patients, the best option would be an uplift surgery, because I can tighten the excessive skin and elevate the position of the nipple and make the breast look nicer and perkier. So the fourth scenario is when the patient is unhappy with the volume of the breast and also unhappy with the size. This is one of the most common situations I see in practice, because a lot of women who had previous children or they had history of breastfeeding, they have much less breast volume but a lot of excessive skin from the time that the breasts were bigger during pregnancy and breastfeeding. These are the patients that can benefit from an uplift to tighten the excess skin and also lifting the position of the nipple and also increasing the volume of the breast with using a breast implant. So to summarize everything, first scenario, when you're happy with the size and happy with the shape, you don't have to come and see me. Second scenario, if you're happy with the shape but not happy with the size, you can benefit from a breast augmentation either with a breast implant or breast augmentation with fat transfer. Third scenario is when you're happy with the size but unhappy with the shape, then an uplift surgery would be a suitable option for you. Or the fourth scenario is when you're not happy with the size and not happy with the shape. In that scenario, a combination of an uplift and augmentation with an implant would be a suitable option for you. But having said all of that, you don't have to make that decision on your own. We are here to help you and guide you through this process of decision making. So when you come to clinic, I examine you, I can tell you what I think, and based on your answer to those questions, we find out what is the best surgical option to enhance your breasts.